More than 130 rural Victorian doctors and other stakeholders are attending the Victorian Rural Health Conference over this weekend. A workforce shortage, ambulance ramping and government initiatives are among the topics on the agenda. Joining me live now for more is Board Director and Conference and MC, Dr Dan Wilson. Thank you for your time this evening, Doctor. Now, I've just touched on some of what you are addressing over the course of this weekend. Can you elaborate on these issues?
The theme for this year's Victorian Rural Health Conference 2022 is Changing Futures, and our members believe that we have the capacity, through collaboration with colleagues and with state and national bodies, that we can truly change the state of healthcare in Australia, particularly here in Victoria. And as you've mentioned, there have been significant workforce shortages, just one of many topics that we're discussing this weekend.
And can you tell me as well, or elaborate a bit more about that? What kind of shortages, what particular roles and what impact is that having? And also the ambulance ramping, can you give me an idea of what that looks like at the rural and regional hospitals?
Certainly. Many of my colleagues and myself working as a rural GP, we've been experiencing ambulance ramping on quite a regular basis across the state. What that means is that patients don't receive the high level of care that they deserve and can sometimes result in delays to receive appropriate care. We're facing shortages not only in doctor colleagues, but also across other healthcare professionals as well, including our nursing colleagues, paramedicine colleagues or paramedics, and other healthcare professionals. So when you say there's a crisis, you're absolutely right.
And what kind of impact then does that have on these communities? You did mention it does impact people's health outcomes. How serious is this as an issue?
It's definitely a serious issue. We see that members of Victorian rural communities are unable to get the level of care that they would normally receive. So, for example, might be waiting up to 3 weeks to see their normal general practitioner, or might be complete delays at an urgent care centre, for example, where if they present with potentially a life-threatening injury or illness, they may not be able to receive that level of care. And whilst that may result in a poorer outcome for that individual and their family, we haven't yet seen it, but what I fear is that it may result in a serious death of a loved one. And the opportunity to act is now, with a federal election looming on our hands. So the Rural Doctors Association of Victoria certainly calls upon our ministers of parliament at a federal level to make significant reinvestments into the Victorian healthcare system.
We have seen, of course, various pledges from both major parties during this federal election campaign. Victoria is also looking at a state election later this year. What would you hope to see from the state government?
The Rural Doctors Association Victoria would hope to see from the state government a return to discussing pertinent issues around solving the workforce crisis, around solutions to urgent care centres, whereby rural Victorians are unable to receive the same level of equity of care that a metropolitan counterpart may receive. So an example of that would be a patient having to pay for out-of-pocket costs, presenting to their urgent care centre with a life-threatening illness. So those two topics are on our front and foremost agenda to achieve in the next state election.
And now, just finally, Doctor, the conference was delayed for the past couple of years because of COVID. How much will the pandemic be part of discussions?
The pandemic, of course, must continue to be part of discussions. The Rural Doctors Association Victoria, like many health organisations, is disappointed to see both a winding back of state-based and federal measures to monitor and control the COVID-19 pandemic. And we look forward to continuing the discussions as to how the Victorian Health Department is able to continue to invest and keep rural Victorian communities safe from COVID-19, because this pandemic is certainly not over, and we will continue to advocate to ensure that our rural Australians living in Victoria continue to be safe.
Very important indeed. Thank you for your time, Dr. Dan Wilson, and all the best for the conference for its last day tomorrow.
Thank you very much.